Catuaba is a powerful plant, and it can improve depression, anxiety, fatigue and more. It's native to several regions of Brazil. In folk medicine, it was used to treat fatigue, stress, impotence, memory deficit and digestive issues. Catuaba is commonly mixed with other herbs like guarana, marapuma and ginger. Catuaba has aphrodisiac-inducing properties. For example, in rabbit models, it's been reported to improve libido. Due to its ability to increase nitric oxide, the catuaba has vasorelaxant effects, and this can help with erectile dysfunction. By blocking the reuptake of dopamine, the catuaba can increase the dopamine levels in the brain. Although it increases the dopamine, catuaba is reported to not have an amphetamine-like effect. By blocking the reuptake of serotonin, the catuaba can increase serotonin levels. Catuaba is a powerful antidepressant. It fights depression by increasing neurotransmitter levels in the brain of dopamine and serotonin, and by improving the regeneration of hippocampal cells. The Catuaba mix was found to be effective in interfering with the synaptosomal uptake of serotonin and dopamine following the long-term oral treatment in rats. In rodents who were subjected to a forced swimming test, the Catuaba produced antidepressant-like effects, and the concentration dependently inhibited the uptake and the increase in the release of serotonin, and especially of dopamine. The Catuaba also increases neurotransmitters by its ability to reduce the activity of the monoamine oxidase A enzyme. This reduction in the monoamine oxidase A actively by the Catuaba has been shown to be neuroprotective and neurotropic. Catuaba can also increase the acetylcholine levels in the brain by reducing acetylcholinesterase enzyme activity. Catuaba can act as an adaptogen by improving stress and fatigue. It can improve fatigue after exercise by increasing the acetylcholine and by improving the antioxidant levels. For example, in mice, the Catuaba could improve fatigue after running on a treadmill and could improve grip strength after exercise. The main phytochemical compounds in the Catuaba bark are the flavin thiols, procyanidin, epicatechin and catechin, the flavoligands, and the phenylpropanoid derivatives like chlorogenic acid. These phytochemical compounds are associated with Catuaba's antioxidant activity. It's stronger than vitamin C and vitamin E, and it's been shown to help to prevent cellular damage that's been triggered by oxidative stress in acute and chronic neuropathological conditions. By acting on dopamine, serotonin, and acetylcholine, the Catuaba may have nootropic effects. In Brazilian folk medicine, it's known for its neuroprotective potential and as a memory stimulant. The antioxidants have also been shown to improve cognition. Catuaba is neuroprotective and it reduces brain damage. For example, it can reduce oxidative stress in the hippocampus, and it can prevent hippocampal cells from improperly dying. By reducing the oxidative stress, the Catuaba has potential in several neurodegenerative disorders like Alzheimer's disease, ALS, Huntington's disease, ischemia, reperfusion, and Parkinson's disease. In models of oxidative stress and neuroinflammation after cerebral ischemia reperfusion, the Catuaba can normalize the levels of glutathione, oxidized glutathione, superoxide dismutase, and protein carbonyl groups, while completely inhibiting the microglial astrocyte activation. It can also increase neurogenesis in the hippocampus. Catuabines have antibacterial effects. They have antifungal effects, antiviral effects, and antiparasitic effects. Catuaba can fight some cancers like cervical, head and neck, liver, oral, and ovarian. It might also help with multi-drug resistance in cancer. By activating the dopaminergic and the opioid pathways, the Catuaba can reduce the sensation of pain. It can reduce carrageenan-induced pain. The Catuaba mix can reduce pain from lipopolysaccharide-induced endotoxemia. The Catuaba can reduce inflammation by inhibiting phospholipase A2 and by blocking COX and LOX pathways in the arachidonic acid cascade. It can significantly alleviate the symptoms by patients with burning mouth syndrome. Catuaba may help with arrhythmias. For example, the mix of Catuaba has been found to both revert and prevent ventricular fibrillation in the isolated rabbit heart. Catuaba may reduce body temperature by stimulation of dopamine. Catuaba may have anti-aging effects on the skin. For example, when a Catuaba extract was prepared in canola or other oils and applied to the skin, it improved the permeability of the skin. It can also raise the sun protection factor in sunscreen, and it's a promising sunscreen alternative. Catuaba might be beneficial for patients with diabetes. In rodent models, it can reverse STZ-induced body mass loss and reduced food and water intake. It can also improve hyperglycemia and other metabolic biomarkers, such as alkaline phosphatase, ALT, and AST. It's also been shown to regenerate the pancreas by increasing the number of pancreatic beta cells and the size of the beta cell islets. Catuaba goes well with ginger, guarana, and marapuma. For anxiety, a typical dose is 800 mg per kg. This might present anxiolytic-like effects in mice. For depression, the antidepressant-like effects were detectable after acute oral administration at 200 mg per kg, although at a dose of 400 mg per kg, there's been no effect on the hippocampal growth. For emotional stability, others have seen benefits at around a 1 gram dose. For fatigue, 25 to 300 mg per kg is what was used in rodents to improve the fatigue from exercise. Females should not use Catuaba as it might have anti-fertility effects. This was seen in rodent studies, but it doesn't appear to affect male fertility. If taken during pregnancy, it might cause the offspring to produce higher amounts of antibodies. Doses of 1000 mg per kg in mice in a hydroalcoholic extract caused death within 4 hours after administration. Although in humans, chronic administration of 25 milliliters of Catuaba twice per day for 28 days caused no severe adverse reactions or hematologic and biochemical changes. Mice that were treated with crude extract or ethyl acetate fraction of the Catuaba appear normal and have no adverse effects at doses of up to 5000 mg per kg and 3000 mg per kg respectively. Before taking Catuaba, always consult a professional. To book a consultation or to learn about herbs, supplements and natural treatments, check out my website.